Recovery after a Brazilian butt lift is something that people always want to know. They want to know when they can get back to work, they want to know when they can get back to exercise, and they want to know the things that they need to do to make it heal the best. A Brazilian butt lift is what we do when we remove fat from some areas with liposuction and add it back into the buttocks area to graft that fat to add fullness where you want it. The recuperation is really pretty similar to what liposuction would be by itself, except for you have one more area that's sore and you do have to be a little protective of that area. Now typically after liposuction, people feel like they are bruised and achy and swollen. A lot of people compare it to when they have exercised heavily when they hadn't exercised for a really long time. It's not the end of the world sore, but it's uncomfortable. Just add into that you'll be swollen and sore on the backside too. Now, we always do want to have some compressive garments after liposuction to make sure that we don't build up extra fluid or blood around the tissue that makes for trouble healing and more scar tissue. So we still do use the compressive garments with a Brazilian butt lift too. Usually it means a wraparound binder for the abdomen, and then typically we'll put stockings up over the hips and thighs. And a little compression on the areas from the butt lift is a good thing, a lot is not a good thing. So we don't want to have it tight around the backside, just enough to kind of help control that swelling. Also, the position that you sit in and the position that you lay in is really important too. We don't want a lot of pressure right on the area where those grafts are trying to take. The fat is moved and grafted and it has to get a blood supply from the surrounding tissue for that fat to live and grow and be healthy. And if you're putting pressure on it, that squishes the blood out of that area and it's not going to get a chance to take. So it doesn't mean you can't sit ever, but we don't want you to sit in for prolonged periods of time for the first 3 weeks after surgery. It's important to get up frequently, walk around. If you're stuck in a chair at your desk, make sure you're shifting your weight around so you're not always on the same place. And do get up and walk even if you are stuck behind a desk most of the time. Also, sleeping position is really important too. The best way to sleep after a Brazilian butt lift would be to sleep on your tummy, and that puts no pressure on the backside while you're trying to sleep. But a lot of people can't sleep like that, so an alternative would be to sleep on your sides, but certainly not flat on your back. And if you do sleep on the sides, we don't want you to sleep on the one side all night long. You have to move from side to side so that it kind of evens out that pressure and evens out that swelling. Now, before you can get back to vigorous exercise after Brazilian butt lift or liposuction in general, usually it's about 3 to 4 weeks, mainly because we don't want to have extra swelling or extra bruising that would interfere with the taking of that fat or with the healing of the tissue where the fat's been taken from. But work, most people probably could go back after a week. And that does depend on the job, it depends on the situation, depends on your healing and your swelling. So it's an important thing for you to talk to your doctor about that before surgery so you can kind of make your plans and then be kind of flexible afterwards too, because sometimes things change while you're healing that would make it necessary to kind of alter your plans.